Doctors are very good about making parents feel very anxious and then walking away before explaining what is happening. Failing a hearing screen in the hospital and not explaining what's going on is a very good example of this. So let's talk about this, and then afterwards I'll share with you the numbers of how many babies actually don't pass this test. In the hospital, most babies will have a test called OAE, or otoacoustic emission. Basically, it's a simple test. A microphone is placed in the ear, a sound is transmitted to the inner ear, the hair cells move, and then the microphone picks up that sound. Simple, but not so simple. There are some problems with this test. Let's talk about that. First, there's the obvious. Small ear canal, little wax in the ear. Anything in the way that can block hearing in the ear can cause this test not to work. You plug your ears, you don't hear. It's as simple as that. The second, less obvious reason involves the type of equipment we use. We put a sound in the ear at different frequencies. High frequency, baby might hear very well. Low frequency, they may not. Depending on the equipment and the age of the equipment and the condition of the equipment, your baby may pass or not pass. Third, if the room is very noisy, there's a good chance your baby isn't going to pass the test. It only takes 1 to 2 minutes per ear to do this test, but if it's noisy, it's not going to happen. So please keep that room quiet. Fourth, it's not just about keeping the room quiet, it's keeping the baby quiet. Calm baby makes an easy test, but try explaining that to a newborn. Fifth, there's a human involved in doing this test, and while it doesn't require much skill to do it properly, some people are just better at it than others. Now, I'm not trying to throw anyone under the bus, but you get the point. Sixth, and the one we all worry about, is that maybe your newborn does have a hearing issue, but isn't that why we're doing the test? So if your baby doesn't pass the hearing test, what do we do next? Fail is what we used to say when a baby didn't pass a hearing test, but now we use the word defer. This was done to try to make parents a little more calm, but I don't think it really worked. With the defer, the first thing most people are going to do is to repeat the test. Half the problems are going to go away. The room may be quieter, the baby may be calmer, the equipment may be working well, the technician may be on their game. For whatever reason, half of the time, the babies who had a problem early on will pass the test. If after the second attempt your baby still doesn't pass this test, then your baby will probably get a different type of test called a brainstem auditory evoked response. This is a much more sophisticated test in which we put electrodes on the forehead and measure brain activity to sound. It's a much more expensive test. It requires a skilled technician, but it's much more accurate, and we can finally detect whether or not your baby is really having any difficulty hearing. So let's talk numbers. With the first test, up to 40 babies out of every 1,000 need to have a repeat hearing test. That's a lot of babies who have to be rescreened. And of those, only 2 to 3 out of those 1,000 actually have a hearing problem. Figuring this out at birth will make a huge difference in your baby's life. So many shares and likes, thank you. I hope I don't have wax in my ear.